Can you guys see my?
Yes, that's perfect.
Okay, perfect. So today I'm going to be talking about recovery-friendly workplaces, and we're going to, well, let me just make sure. Okay. Some of the objectives I'm going to be going over. It's just a definition of what it is. I want to take a minute to just look at some of the statistics about individuals who are in recovery in the workforce, and then look at the benefits of why this is so important. And not only for the employee, but also the employer. This is really a mutually beneficial relationship when you are a recovery-friendly workplace. And I want to just talk a little bit about what it looks like, what those pillars of recovery-friendly workplaces are, and how to implement them. So obviously, I think it's important that we start with a definition. And the definition of the recovery-friendly workplace is a place that supports their community by recognizing recovery from substance use disorder as a strength and being willing to work intentionally with people in recovery. And that's really the key, is that it's not like we happen to hire people in recovery and then we treat them well. It's we have a goal and an intention, and we purposely view this population as people who can add a lot to our community and really do it with intention. Recovery-friendly workplaces encourage a healthy and safe environment where employees and employers and communities collaborate to create positive change and eliminate barriers. So that's really the definition I want you guys to keep in mind as we're talking about this. One thing that I just want to recognize is how important employment is for many people in recovery. But I also want to acknowledge that it is also challenging because there are many triggers that can happen when somebody is entering back into the workforce. But we really want to be able to recognize that when somebody is in recovery, having that job, having the structure, having a sense of purpose, all of those things can be so valuable and contribute to their ability to maintain their sobriety and give back to their communities in a way that allows them also to feel a lot of pride. So because this is so important in terms of helping people achieve and maintain their sobriety, there are a lot of efforts going on among recovery organizations to promote workplace supported recovery and to make this something that is part of the community, and to make it easier for people who are newly or have been in recovery for a while to be able to get jobs and be employed. A quote from one of my current employees who is in recovery, who shared with me their experience, said, "Addicts, like everyone else, need to provide for themselves and their family. They have not done so for quite some time due to using and are now eager to make up for that lost time. But if they are unable to gain employment, they have no way to change their current situation except to return to past activity. This leads them back to more issues with the legal system and places more cost upon the healthcare system to treat them again. However, if they are employed, they support their families, they pay their bills. Their families spend money contributing to the economy. They start to give back to society rather than drain the public funds for their support." And that was this individual's experience about what it was like for them to be able to feel like they made that shift. And I thought that was really powerful in terms of sharing their experience. A couple of characteristics that contribute to a recovery-friendly workplace. One, there needs to be employment opportunities. We need to hire people. We need to be willing to look and hire people. We need to look at our practices and our policies about what do we do with individuals who may have criminal backgrounds related to their substance use disorder, and how can we make people employable. Um, Allowing help-seeking behavior, as I mentioned before, and I'm gonna go into a little bit. There are a lot of triggers that can happen when somebody enters into the workforce. One of the ones that I've talked about with a number of the people I've worked with is money. It could be really challenging for people to all of a sudden have a lot of money if they're newly in recovery, because that can trigger some of my staff. And we've had that conversation. How can we support you with that? How can we make it safe for you to get paid and use that money for the things that you want to and not be triggered or not struggle? Or do you have enough coping skills or stress reduction skills? Because working at any job is very, very stressful. And how are you going to be able to do that and not get triggered? So we want to be able to allow people to know that this is a safe place to ask for help and say, "I'm struggling. I need a little bit of help," and get that support. And then to have access to needed services. I'm going to talk about some specific ones in the end, but having EAP available, having different things available so that if somebody is having a tough time, that there are services that they can reach before it becomes more of a problem. Um, Providing reasonable accommodations. And some of these accommodations may just have to do with timing of work. Some people need different shift work, or they need different schedules, or they may need different accommodations. So that's, what is reasonable. Providing education and support. And also just acknowledging a recovery supportive environment. One of the things that is important is to be able to state that this is a company that supports people in recovery, so that it makes it safe for them to talk about it themselves. It makes it safe for them to support each other, which I'm going to talk about. So we really want to kind of have some of these characteristics. One reason that recovery-friendly workplaces is so important is, this is probably my favorite data point that I'm going to share today, is roughly 2 in 3 adults with substance use disorders are employed. So if you work in a room with multiple people, the interesting thing about working with people in recovery is that in most workplaces that have multiple staff members, you already do. You may not know that they're in recovery, they may not be sharing that with you, but statistically, if you work for a company that has a lot of employees, you are probably already working with people in recovery. And the question, if you don't know that, then the question will come, is the reason we don't know it just because the person is choosing to keep it private, which is absolutely right, or is it not a recovery-friendly workplace enough to make it safe for them to be able to share that? Because the likelihood is somebody is. A couple of key statistics. We have about 22 million people in the United States who identify as being in recovery. So that is a large percentage of people who could be working. There are about 13.6 million people with alcohol or drug use disorder who are currently currently employed. So there is a difference there. Obviously, there are a number of people who are identified in recovery who are not currently employed, and that could be for multiple reasons. Some may be that they're just not employed this time. Some may be that they're retired. There are about 2 million people actively in treatment at this time, and there are about 13 million people who are employed and in recovery. So that's why I'm saying it's likely that we already work with people in recovery. And of the entire workforce, about 12% of the workforce is currently in recovery. So this is a part of who we work with every day. Why this is so important for the employee, as I mentioned earlier, it can improve their emotional, physical, and health. It can allow them to be a role model and support others who are seeking work and in recovery. And it can reduce the likelihood for relapse because it does give them that sense of purpose. It also can provide a lot of structure and support. As I mentioned, it can also contribute to some triggers, so we need to be careful with that. But for individuals, there's a lot of benefits. There's also a ton of benefits for the employer. One, research continues to show that people in recovery give back to the community at a rate double than the population. So these are people that we often want to promote and support and represent our companies because they are giving back to the community. They are willing to volunteer, really good work ethic, and they have a lower turnover rate and increased commitment to employment. And one of the things that I find most interesting about that is many of them take the jobs that a lot of people don't want. So we have an expanded labor force in a lot of ways to take people for difficult to fill roles or difficult to fill time slots, because a lot of the staff that I've worked with who are in recovery are very excited to get back to work, are aware that, obviously, they have a history that will make them unemployable in some locations. So when the jobs open up that may be a little bit more challenging to fill, they are more willing to do that and be more dedicated to those jobs. So it really can be a great resource for employers who have those difficult to fill spots. And research also shows that there is reduced absences, lower healthcare, lower disability, and less workman's comp costs when our individuals are in recovery and taking care of themselves and working. So they really can be incredibly talented and dedicated and wonderful employees. Talking about how do we actually go about and create a recovery-ready workplace, there are 4 main pillars. One is prevention and risk reduction, one is training and education, one is hiring and employment, and one is treatment and recovery support. So I'm going to go through these very quickly. With regard to prevention, we want to be able to identify substance use risk factors in the workplace and proactively take action to reduce them. So I work for Pyramid Healthcare. We do mental health and substance abuse treatment. So one of the challenges for a lot of the people who come to us who are in recovery is they may actually be put in touch with the actual substances that they use. Some of our clients come in and they are actively using, or they bring in contraband, and it is part of their job in many of those occasions to deal with that. So we need to be able to identify that as a risk and come up with a safety plan, because if I'm working with somebody who may be faced with their drug of choice as part of their workload, that is something that we want to acknowledge and deal with and address it, and not address it as this is going to be a problem, I hope you can handle it, but hey, if this is something, what plan do we have to support you in case this happens? Because it is possible. So we as a company need to be aware that this could be a trigger and also be able to have the discussion about how do we plan for it, and support the person. And some of that also has to do with training and education. So for that to happen, leadership, supervisors need to understand that we are, that we do support people in recovery, that we do hire people. They need to be willing to have those conversations. They need to be willing to support the person in that moment. They need to be mindful of their language and the way that they speak, and that requires a lot of education. I would also say that it's really important when we're doing hiring and employment that we have policies that support that we make sure that people know what the policies are, that people understand who we hire, and also to know what that means. There are certain parts of the jobs that some of my staff have that they cannot do if they have certain criminal histories. So we need to be able to do that and then adjust the job for them. Not, well, we can't give you this job because of the 20,000 tasks you need to do, 2 of them are going to be a problem. It's how do we remove those 2 tasks and allow you to do the other 20,000 things that you need to be able to do. So to be able to adjust with that. Treatment and recovery support, we really want to make sure people have access and that they know that they have it early. One of the things that I think is helpful is I do a lot of our orientation, which is usually on day 1. And we mention EAP services that people have available to them on day 1. So if somebody is coming back into the workforce and it is more difficult or triggering to them, we want them to know that you could call EAP today and we won't know, and it's not a problem, and there are resources available to kind of give that support. We also really want to try and encourage people to know what wellness programs are available, what kind of things they could do to support themselves, what insurance will cover, all of those types of things, so that if people are in need of some additional treatment or support groups or whatever it may be, what is available through the company and what's available through their benefits. And then we want to engage and communicate. We want to communicate with the community around us that, hey, we are going to hire people in recovery. This is an important part of who we are as a company. We want to make sure that the board of directors, the stakeholders, the people understand this and support this vision so that the policies and procedures and all those things can match what you're saying. Because it's one thing to say you want to support recovery, but if you don't have the infrastructure to be able to do so, it becomes very challenging for the people to actually be able to do it. So we want to make sure that we are engaging with leadership, we are engaging with funders, we are engaging with, board, whoever it may be, depending on the workplace. A couple of key successes for these is we need to be clear in our expectations. We need to let people know what is our protocols and policies. And we need to be consistent of the policies and the follow through. So whatever those policies are need to be consistent. And we need to make sure that staff and leaders and supervisors know what these policies are and also know who to reach out to if something happens. One of the things that can happen, for us at least, is we do have a policy where we can request a urine screen if we believe that somebody may have come to us under the influence, but there are very specific circumstances of how that happens, who does that, who addresses it, if all of those things. So we need to make sure that those policies and procedures are clear and they also know who needs to be involved, because we want to do that in a way that is supportive of the site, but also of the individual. We want to make sure that it is not something that is very public. We want to make sure that it's not something that is, embarrassing in any way. We want to make sure that they get the support that they need. So there are a lot of policies about it. So that's something that people would need to look at. A couple of practical implementations. I mentioned the EAP availability. We also have Kindly Human, which is a service that we have that's free, that allows peer support for mental health. So this is not professional support, but this is peer support, which I have had conversations with a number of the staff members that I work with who say they find that actually less intimidating than EAP. Because for my staff member who are used to being in the rooms, calling a peer support and talking to somebody feels more comfortable and natural to them in a lot of ways. Doesn't matter to me what you do. I don't need to know any of it. It's all confidential, but just having both of those options I like, because it allows the person to access resources in a way that feels most comfortable and for them. And then support through relapse. Our hope is that none of our staff members who are in recovery relapse throughout their treatment. But I also think that that is not necessarily a realistic hope for when you're an employer as big as we are. So you want to make sure that we have policies and protocols, non-judgmental, and supportive response to relapse. And really that involves a lot of the HR work in terms of what are the policies, what are the procedures, how can we get them help, what does that look like, how do we bring them back to work? And I think one of the things that's really important about that is if you ask me what I know least about, it's that, because I don't work in HR and all the work they do is so confidential. So I know in theory what happens, but I actually don't know a ton about what happens to my staff when those things happen, because it is treated very confidentiality. And I think that that's important. I just wanted to end with two quotes that I got from staff members as well. One was, I know there are others who are struggling with addiction who I work with regularly, and if I can be part of their journey by helping them find the path, then that sense of duty and obligation is fulfilled. I say to individuals struggling with addiction, you will all die as addicts, that's inevitable, but not a single one of you have to die because you are an addict. And I hope that serves as an inspiration to some, but because I am certain it acts as a reminder to myself. And that is somebody who's very open about their recovery and shares that with a lot of our staff. And then another staff member told me, I'm a more dedicated, committed, and responsible employee because I am in recovery. Rather than being seen as a potential negative or liability, it is what makes me know every day how lucky I am to wake up, to go to work, and take care of myself and my family. Being employed not only helps me stay sober, but staying sober helps me be a better and more effective employee. And I think that's really important, is that we have to recognize that there are a lot of benefits to hiring people in recovery, and it benefits them, but it also really does benefit the company. So it does require a little bit of extra work in terms of policies and procedures, but it's worth it because the benefits to the company are huge. And I did put a couple of resources here that you guys can see. And that's what I have for you guys today.